Now, this was the final randomized controlled study performed with endobronchial valves. It is very important because it incorporates everything we've learned in all the other previous studies. It's also very important because it's a multinational study being undertaken in the United States and several centers in Europe. There were 190 patients randomized, 128 to endobronchial valves, and 62 to the standard of care. Now, the other very important aspect of this study is ensuring that the valve treatment was done properly. And if you do not perform the procedure properly, you are not going to get a clinical improvement. Now, this is very similar to surgery. If you undergo surgery, you are not going to have an operation and then a surgeon does not take out any lung tissue. Here you have a condition where this tweaking allows us to evaluate these patients at around 45 days to see if the valves are implanted properly and there's a volume reduction. And it gives the operator an opportunity to try and revise the procedure to ensure that there's volume reduction. So in this study, the other very important point is that this is an endpoint which is at 12 months. Remember, these patients are declining all the time, and hence there's a deterioration in their normal function. So to choose an endpoint at 12 months is a huge challenge. Nevertheless, you can see that there's a significant improvement in these patients of almost 100 mils at 12 months. Their 6-minute walk test appears to be maintained at 1 year, and their quality of life is very obviously still persistent at 12 months. If you look in more detail at their lung function change, you can see that there's a maximum improvement around 45 days and then a gradual decline, which we observe in all patients with emphysema. Similarly, you can see that all the parameters in the right direction. There's an improvement in the treatment group, whereas there is no change in the control group. And similarly, with the 6-minute walk test, a significant improvement in the treatment group, but no real change, but actually a deterioration in the control group. Now, if you look at responder rates, most of these patients respond in different ways. If you have the very difficult endpoint of a change in FEV1 of 15% at 12 months, you can see that almost half the patients, even at 12 months, had a significant improvement of more than 15% in FEV1. If you choose an endpoint of change in residual volume, almost 61% of patients improve. Now, the reality is that what we are doing with this technology is reducing residual lung volume. And technically, you can see the last measurement, TLVR, which is the target lobe volume reduction, improves by almost 84% in these patients. So treatment was effective and it achieved what it was intending to do. And that translated to clinical improvements at 1 year in a number of parameters.